So I thought what I would do is I would make a couple videos kind of explaining some topics in dentistry. The first topic being cavities. So everyone goes to the dentist, everyone hopes to not have cavities. But we need to stop and kind of think, what exactly is a cavity? A cavity is, in actuality, just a defect in a tooth. Defect in tooth, right? And so what we need to think about is what actually causes the defect. And when dentists talk about this, they talk about dental caries. So dental caries is the infectious process by which we get cavities. Now, the thing to do is if you ask anyone on the street and you say, what causes a cavity, most will say it's from not brushing your teeth or from eating too many sugary things, but every once in a while you'll get someone who says plaque. And they're on the right track, right? So plaque. Plaque is a gelatinous mass, so I'll say gel mass, of bacteria. And so we have this gel mass of bacteria, which once you see the word bacteria, you think, okay, so this is an infection. So in the mouth, we have discovered like 200 to 300 different species of bacteria and funguses and protozoa that kind of just hang out. Now, most of the time, they just they're all present, but they don't really cause any harm. But every once in a while, if they get in the right numbers or kind of get out of equilibrium, they can cause us problems. So, in the case of plaque, what we have is one particular species of bacteria that gives us a lot of problems called Streptococcus mutans. So sometimes you'll see it written as strep mutans, S mutans. And so what happens with S mutans is that it sits around in this plaque and it eats the sugary things, so let's say sucrose or sugar, in your diet. And when it eats those sugars, when they metabolize those sugars, they create a waste product, and that waste product is acid. And so acid is really the important thing here, because the acid is what causes the cavity, right? So we have teeth here. Let's get some teeth up here. So I'm going to clear this. So we have some teeth. Here's a couple teeth. So here's some teeth. So teeth are about 95% mineral content, with the other 5% being, proteins, mainly collagen, and water. But 95% is mineral. So this is, technically it's termed hydroxyapatite, and that's where you hear the fluoride and calcium debate, which we'll get to in another video. But in this case, so let's get some plaque on these teeth. So let's say we didn't floss for a little bit, and so we get some plaque that's kind of staying in between where these two teeth are in the mouth. And there's gum tissue here. Let's not say that they're exposed. So we have some plaque in these teeth, in between these teeth, and it's staying there. Now, why is that important? And so this is a little plaque colony. So a lot of S mutans living here, and they're eating the sugar that they're exposed to every day. And so what we've found out about teeth is that teeth demineralize or dissolve at a pH of about 5.5. If you'll remember, a pH scale is a scale of 1 to 14, where 7 is neutral. And so usually your mouth is around 7, but what happens every time you eat, you have these strep mutans hanging onto the teeth, And as they eat, they create acid, which lowers or makes more acidic the localized area. So we have this strep mutans, and it's going to encounter some sugar. So let's graph this. So if we think about it, we have this is a pH. Let's say this is the pH of just this local plaque, okay? And so normally your mouth is about 7. And this is a pH scale. Now we know that teeth dissolve at about 5.5. And so let's say this way is time. And so what happens is most of the day, your mouth is at a 7, so you don't have this plaque and everything is at a 7. We don't have any acid really being formed. And let's say like right here you eat something. So let's say you eat some, let's say a sugar cube. Eat a sugar cube. So you eat a sugar cube right at this time. Now, what's going to happen is that sugar is going to be eaten by the S mutans and is then turned into acid, which is going to lower the pH, right? So we're going to have a low spike of this pH. And so now that the pH is lowered, you've eaten the sugar's gone, and you have your saliva, you drink some water, you have all these mechanisms to kind of balance things back out. And so this is going to slowly come back to normal, right? And so this is the crux of the whole situation here. The pH in this time right here is the time for demineralization. Let's just write it out. Demineralization of the teeth. So what we want to, there's a whole, this is kind of the crux of all of dentistry. Now, we'll kind of go through this in more detail later, but, as you can imagine, if you don't clean this plaque off, and it stays, and every time you have an encounter with any kind of sugars, and it doesn't have to be sugar, it can be bread, it can be any kind of carbohydrates that get broken down into a simple sugar, but these S mutans are going to cause these little acid spikes, which are going to kind of demineralize this tooth. So let's say, so if this stayed over time, this acid is going to eat away at the tooth here. And if it stays longer, it's going to get bigger. And we're going to get a little defect or a hole in the enamel of this tooth. And that is your cavity. So there's really a whole lot to talk about here, especially this graph. But we'll have to get to that in a different video.